You're listening to the Patient Advocacy Now podcast, presented by Greater National Advocates.
It's just gut-wrenching sometimes. Like, if it's sad and they're crying, I might cry.
Amazing how many doctors do not even want to treat somebody who has Medicaid.
Medical system is about making money.
And I said, so are you hiring more nurses, or you're just telling each nurse to work harder?
Dr. Chris Price, or as everybody calls you, Dr. Chris, thanks for being on the Patient Advocacy Now podcast. You're another physician, another retired kind of physician turned advocate. We had one before, Dr. Alan Farron, and it's nice because it's nice to have you on, or not that you're all homogenous, but to have that perspective on the show, because you do bring a different perspective being a doctor, being an MD. Wouldn't you agree?
I would, and thank you for having me on the show. It's a great honor to be on here.
Yeah, my pleasure. Let's dive right in. What was your favorite part, and what is, I mean, you're still practicing, but what is your favorite part of practicing medicine? Why, what was the calling? And did you find that you end up falling in love with something that you were surprised by, or was it kind of right on cue and you're, excited that you went into it?
It really surprised me at the time. I ended up going to medical school. I had always wanted to be a doctor since I was 6 years old. My mom was a ICU nurse, and I think so. I spent most of my early years in the hospital just kind of wandering around waiting for her to be finished. When I finished all my training, I went into cardiology. And the thing that I loved the most about it was the times when things got really hairy, really concerned, like someone is having a heart attack and they're in the throes of trying to die on you. That was my most calming part that I could ever have. It was kind of like my Zen moment where I was telling jokes to keep everybody relaxed. And it was just my point where everybody appreciated the calm feeling of someone just kind of going through this. And then afterwards you go out and say everything's great or not. And just that interaction with people and kind of at their most vulnerable part just brought joy to my heart. And that's kind of the real reason that I really loved doing what I did.
So you have it sounds like you have a natural ability to be calm in the middle of the storm. And so you found the perfect kind of fit for it.
Mm-hmm. Yeah. There are times when I'm not calm, and my boys will tell you that, but like we all have our Zen moments, and that was kind of like my Zen place always, just to be a calm in the storm, and it made things work out better, and things. So I think that was kind of the nice part.
That's really cool. I wouldn't have guessed that. I'm glad we got into it.
Yeah.
What kind of happened? So in 2017 you retired, and then you also, when I was reading your bio, you mentioned that there was kind of a health issue that drove you even further into advocacy. And I know doctors are advocates for their patients from day one, but kind of diving deeper into the idea of being an independent patient advocate. What's your story and what drove you there?
So I practiced cardiology for 20 years. And then around 2015, I developed a second autoimmune disorder, which I was undergoing therapy for. And it just was causing a lot of problems where I actually developed autoimmune hives. So in stressful situations, I would break out in hives head to toe and things of that nature. It was never during my Zen moments, like I just mentioned, but it was like stressful parts of trying to explain to someone that we need to do stuff in the office and things like that really got. And I literally would scratch myself till I was bleeding in front of my patients. And it just wasn't a good look, wasn't a good feel, and all of that. So I ended up taking time off and ended up retiring at that point, just to kind of get things back. I'd been doing advocacy for family and friends since medical school. It seems like once you go off to medical school, they all think you know more than they do, which you do a little bit, but at the same time, it's just, you really are more of a sounding board at that time. But as I, was practicing, I learned more and was able to help more and things of that nature. Once I got myself back to a better place physically and mentally, I still wanted to give back. And that's, and I thought, look, I've been doing this advocacy for 20 plus years. Let's just see if I can still help people. And that's what got me looking into it. And then I ran into Health Advocate X and then also NAC, the two different advocacy agencies, and just kind of found a community I felt like I could help.
Yeah. And do you find that you still have that ability to kind of be zen and calm people down through your advocacy work now?
Yes, I mean, my favorite part is actually being in the hospital when things are not going well for the patient. That's kind of like my sweet spot, and it's kind of those Zen moments where you can sit there and you can calm people down and say, "Look, we're going to get through this. That we will, everything will turn out the best it can. You can't promise that everything will always turn out good because
Right.
life happens." But at the same time, if you can get people calm so they can make the right decisions, that's actually the best thing for people. And I think that's one of the specialties I really do bring to the advocacy part.
Talk to me a little bit about, especially if you're going into the hospital with people, where's that line where you can't cry and because you're offering medical guidance, but you can't practice medicine? I kind of feel like you have the unfair advantage of having the MD, but then you have this unfair disadvantage of, the regulation you kind of have to step around.
Yeah, I mean, you basically walk in with one hand handcuffed behind your back because you can't write the orders, you can't tell people what to do, things. So it's a balancing act when you do it. But at the same time, really what I try to focus is just explaining to the patient and their families what's exactly going on. Because a lot of times the nurses and the doctors don't have the time, in the middle of days, especially when they're overstretched and all that, to really spend and kind of dive deep into the information of what's going on and why we need to do these things. If I can spend the 5 to 10 to 20 minutes explaining why they need to do these tests or why they're doing this stuff, it allows everybody to calm down. And it also gives them more empowerment. If the more you know, the more empowered you are to make your own decisions and to make the right decision for you. And I think the one thing that being a doctor has told me is that, you can't force people to make the decisions you want to make. You have to allow them to make that decision, and then you have to just support them through that afterwards.
Yeah.
Like when I was a cardiologist, I had patients that would continue smoking. And it's like, okay, I'm going to tell you once, smoking's bad for you from a heart perspective.
Yeah.
But I want you to come back, so I'm never going to say it again. We've had this discussion, we've had this conversation, but I want you to keep coming back and not feel threatened.
Right.
And you have the knowledge now. This is your choice. Okay, fine. We'll just keep working. And I think that's kind of the approach I've always taken with both of these kind of scenarios.
Yeah, I like that. And there's something about you're very warm. I don't want this to come off the wrong way, but you seem
Okay.
very data focused, and it's like, let's make the decision. And it's interesting because there are advocates with different personalities, and a lot of nurses, especially if you came from like an ICU or an ER, they have that kind of emergency. But then there are also advocates who are advocates because their mom had an issue or their own child, and there's a more maternal kind of slow. They're kind of amateur counselors by default because they're talking to people. I think the profession attracts, because of the caretaker nature, a lot more women, and so it's interesting to hear. I'm always surprised. Like, you can find the advocate that's right for you, whether you need that direct approach with the MD kind of knowledge, or you need someone to hold your hand a little slower. And I think you're kind of evidence that you can get it on both sides of the spectrum.
Yeah, totally. And I also think that, what patients need to realize too is that if their doctors aren't that way with them, if they don't feel like there's a good relationship, they should look for a new doctor because it really is a working relationship between two people. Just like a marriage, if one doesn't work, it's not going to work long term.
Yeah.
You want the best outcomes for everybody involved. And I think having that approach, if you want the data to understand it, great. I'm the best, I could be one of the better people for you. But if you want the hand holding, I can do some hand holding, but I'm not the best motherly type,
Sure.
and all that. So.
Yeah, but that's great to know your lane. And you mentioned something interesting. It's like you should know that you can get a new doctor. And I think that we were talking a little bit in the pre-interview about informed consent and knowing where your rights are and knowing what is and is not available to you as a patient. You have kind of an interesting opinion on informed consent in the medical space. Would you mind going into it a bit?
Yeah, I'd be happy to. Yeah, I think, a lot of times, I mean, from my own perspective, I went through when I was having all my health issues when I stopped, I ended up passing out also four different times in front of my wife and kids, gave them
Oh, wow.
PTSD from that. Ended up getting a pacemaker just because my heart was stopping for more than 20 seconds at a time. Um, and when I went in there, I noticed everybody's like, "Well, here's the consent form. Just sign it." And it's like, "Well, yeah, I know what these things are, but come on, show me how you actually do the informed consent." And what I found with doing advocacy also is that a lot of times they'll just come in and say, "Well, you're having this colonoscopy or you're having this test." They don't explain the risks. They don't explain this sometimes. I'm not saying every doctor does this, so please don't label it as that. But a lot of times it's just a rushed, thing where I think people really need to understand the reason why, the medical reason, the personal reasons, and all the stuff to really kind of get into this, so they can make their best informed consent. And I think a little bit of knowledge goes a long way, and that's what you know. And unfortunately, the medical field right now doesn't have the time to do that.
Yeah.
It
I've
just
seen it firsthand. I've been in with family members who have just come out of a procedure and they're still, kind of in that twilight after anesthesia, and the nurse comes in to have them sign something, and I'm like, if I wasn't here, they would just sign it and not have any recollection of this.
Mhm.
It's and they're doing the best they can, but it's like the systems just really aren't in place. Uh
Yeah, and similar to like when we were talking in before the
Before the
episode
interview.
started.
Yeah.
Yeah, I I have this family friend who's 90 years old, and she's in the hospital, and I tried talking to the nurses and the doctors to see what's going on, and they're like, "Well, we explained it to her, and she does." But I'm like, I just got off the phone with her, and she has no idea. And if you really think about it, when you're sick and in the hospital and you're alone, are you
Yeah.
really at your best mental space to make these decisions, or should you
Well,
have
especially if
someone?
you have no medical background, you feel
Yeah,
completely powerless. Yeah.
or you're infected and you have a fever of 102, and you're a little delirious, and I mean, you're not really delirious from a medical perspective, but you're not all functioning 100%.
Yeah.
I think it's best to have someone kind of look out and just look at it, be able to weigh, okay, is this a good thing or not, because that's really what's best for everybody.
Absolutely. What was you said you ran into Health Advocacy X. Did you just find it when you were looking into advocacy, or did somebody introduce you? How did you, I'm always curious how people kind of come into the space.
So my wife was part of a women's group down in Seattle, because I live just north of Seattle, and one of the people there is was a member of Health Advocate or is a member of Health Advocate X, and so she told my wife and her were talking, and just she mentioned that I was looking into doing this, and she's like, "Oh, check this out," and that's how I got into it, and then
That's great.
it blossomed from there.
Well, I'm talking about blossoming. You were department chair and you were director of non-invasive cardiology. So I don't think it's surprising. I think you're also a board member of Health Advocate X now. Is that
I am
correct?
now, yes.
So you seem to kind of go straight to the top wherever you go. What's the? I mean, I'm so ingrained with what I'm doing on the podcast. I'd love to hear more about what the mission is and kind of what's in store for them. Do you want to share anything on the Health Advocate X kind of side?
Yeah, the mission really is that we're just trying to inform the public, and allow people to know that they do have people out there.
Hmm.
That there are people to help you through these situations. You're not alone, and it really is about giving back to the community and helping people through these times of need. And health issues scares everybody, and it's just it's just a really good thing to do. Things we're doing is that we have a community conversation where we take a topic each month, and do really kind of uh, expand upon that. Like last month, we had an entire thing on menopause and on treatment with postmenopausal treatments and things like that, which was interesting. We had an OBGYN come in and talk about that. Next month, we have
When you
uh,
say you have these talks, are they are they available to the public
they're
or?
free and available to the public. It's a Zoom talk where we have a moderator, and then we have a speaker come in and just do their specialty. And so we're trying to kind of mix it up and get things out there, the things that you don't see out there in most places. Like, there's the American Heart Association will talk about heart disease and things like that. Yes, we in February, because it was Heart Month, we talked about heart disease, but for the rest of the year, they have that stuff available. But it's just stuff that's important that people want to hear, but just is not really getting its full limelight.
Yeah. So it acts as kind of like a mouthpiece for certain things and a megaphone to kind of let people know. Are you also involved with CHICAO, with the Coalition of Healthcare Advocacy Organizations?
I'm on that. I work with the members of NAC and GNC and everything, or GNA. I'm sorry.
Yeah.
And everything with Brad. And it's been a great experience to kind of see if we can get everybody to coalesce into one overreaching group and things. So
yeah. Well, I mean, I'd love to hear your perspective, kind of the good, the bad, and the ugly of what you see as an MD for the independent patient advocacy space. Do you see that there's, obviously the good we all know because we're saving lives. Are there things where you'd like to see growth and improvement across this kind of growing and kind of new industry?
I think the one thing I would love to see is that insurance companies actually pay for this as part of their insurance plan. Because what we found, there was a paper that was recently released that having a health advocate with a patient actually reduces time in the hospital, reduces costs, and you have better outcomes. So those are the three main wins for everything.
Right. It makes sense on the actuary table. Sure. Yeah.
Yeah. And, insurance companies, they are businesses. They have to look at their bottom line and dollars. But this is actually helping them save money also. So I would think that this would be the one thing that I would really love to see happen in the next, I'd like to say the next year, but we all know how things work in business. It takes 5 probably to 10 years for that to happen.
Right.
But that would be the one thing I would really love to see, because I think a lot of people are, not able to pay for this as much as it, can be, because it does cost, it's our time. We have to pay for our, overhead and things like that to keep our businesses going.
Sure.
I wish, just like I used to say when I was a doctor, I wish my profession didn't exist, because that meant everybody was healthy and no one was having heart problems or things like that. Just like with advocacy, I wish the system worked perfectly, that no one needed us. But unfortunately, that's not the case. Until that day comes, we will be here and we will help people. But I wish it was more affordable for everybody, because,
Yeah, and I know. I know on the Greater National Advocate side, there's always fundraising going on. Do you find that that's happening also with Health Advocate X and CHICAO and everything, and NAC and everything?
Yeah, I do. Yeah.
Yeah, because it is. I think that's the biggest stopgap that everybody's trying to overcome.
Yeah, and things are just getting more expensive too. As the world is going, post-pandemic, it still hasn't gone back to the pre-pandemic levels, and it is what it is.
When you give medical guidance as an advocate, do you? Obviously, with your cardiology specialty, that's going to be a shoe-in fit if someone's dealing with that issue. But do you find that there are other patients and other demographics that tend to gravitate towards you, or that you enjoy working with?
I enjoy working with all the patients. The only ones that I don't feel comfortable working with, because as a cardiologist, you kind of were brought into most cases where you had to clear someone to go to surgery for their knee or a vascular procedure or something like that. So and also to become a cardiologist, you're an internal medicine doctor first. So I'm an internist also. So
okay, I didn't know that.
Yeah, so you have to go. The way medicine works is that once you finish medical school, you take a residency. And so I did internal medicine residency, and then you break off and do a or a fellowship or a subspecialty, either GI, neurology, cancer, cardiology, and things like that. So it breaks up that way.
Gotcha.
So I was a board certified internist. I've let that lapse, unfortunately, but I still have all that knowledge. The only thing I never got.
How long? What's that process? Just because my own personal curiosity, what's the process like in terms of timeline to go from an internist to a cardiologist?
So I mean, the basic thing, which is different now, because a lot of people take take a gap year or two off in between. But I was one of the last that went through straight from college, which is 4 years, 4 years of med school, then
Hmm.
4 years of residency, which is the internal medicine part, and then 3 years of cardiology. So by the time all that, I was 31, 32 when I finished.
Oh,
And
wow. That's
so,
incredibly
so
young.
it's a long time of being in school. I
Yeah.
remember going back to my college reunion. It was our 10-year reunion, and everybody's like, "Oh, I'm on my third job at this," and I'm like, "I'm still in school." You know, it felt a little weird.
Yeah. Well,
So,
you came out
but
on top.
oh, I know. I it's just one of those kind of funny things. You look back and you're like, "Yeah, that was a little weird," but okay, that's just the way it is. You know.
Well, from my experience dealing with people, if you ask them in their 40s and 50s and 60s what they did during their 20s and 30s, they're like kind of nothing, kind of. So I think you spent them very well.
Yeah. But getting back to the question you asked, the only things I don't really feel comfortable with is OB, because I never really did much in terms of delivering babies except for the 2 month period of time in med school.
Sure.
Pediatrics, because I didn't spend any time with little kids except for my own.
Yeah.
And then mental health, because there are so many nuances with mental health, and unfortunately, that is one that needs the most help right now.
Yeah.
There's just not enough resources and not enough people doing it. But you also want to do it. If you're going to do it, I've always felt that you have to do it well,
Yeah.
and you don't want to do it kind of halfway, because that
Yeah.
can actually harm people more than anything else.
Yeah. And it's also one of the youngest medical professional fields and the one we know the least about the brain out of any other organ. So
Exactly. Yeah.
it's a tough hill to climb. Um, Call Dr. Chris if people do want to reach out to you. What's the easiest way for them to do so? I have a couple more questions, but I don't want
Yeah,
to
no, but the
forget to
easiest way
kind
to
of.
do so is just through my website, which is Call Dr. Chris, and that's spelled out completely. Doctor is spelled out,
Okay.
.com. And you can either send me an email from the website, or you can call me directly. My phone number's on there, and I answer my phone all the way up till 10 o'clock at night, because I know
Wow.
that things happen in the middle of the night, and that's when people need you the most. And if you can get people calmed down and say, okay, we can deal with this in the morning, this is fine. Or if we need to work right now, we'll work right now. So,
Amazing. I work nights with some clients myself, and it definitely burns you out, but it's sometimes those calls are the most critical, and so I appreciate you doing that for the
no
general
problem.
public. That's really great. Um, Couple fun questions, or maybe not, who knows, depending on your answer. Do you have a favorite quote that you try to live by?
I do have a favorite quote. When I was a little kid, we used to watch the Emmys all the time growing up. And there was a time when Red Skeleton, which most people nowadays don't remember who Red Skeleton is, but he was the original clown back in the Sid Caesar days.
Yeah, sure. I
Uh,
was a big fan. Yeah, Red Skelton. Yeah.
um, he got a Lifetime Achievement Award um, from the Emmys, and he gets up there and he said something that really struck me. And I was probably 6 or 7 years old at the time, but he said, "When you're climbing the ladder of life, you be good to each person on each rung, because as you go through life, you will be climbing back down that ladder of life, and they'll be good back to you as you go through that." And
Great advice.
it, coming from a guy who didn't speak much at all, it was a great, great advice, and I really try to hold to that, because it's just, you just never know, And I think being good to people, going up and down the ladder of life, is the best way to get through everything.
Yeah, I have a couple concert shows of him on VHS that I kept. So you're reminding me to digitize them, because he always closed his shows with like a really nice sentimental kind
Mm-hmm.
of thing about how he liked being a clown and whatnot. So and the gift of giving people joy. So I think that resonates with me too. I'm sure people listening, it'll resonate with them as well. I have another question for you. I'll leave you with this. If you could change one thing in people, what would you like to change?
I think the one thing I like to change is just people taking um, just more care of learning more about their own body. Because I think, doing this, being a doctor, being an advocate, people really don't remember, or were never taught in school, what each organ in our body is and what it does. I mean, just a rudimentary kind of knowledge. We all know we have a stomach, we have a gut or something like that. We have a heart. But just a little bit of knowledge, I think, would go a long way, because just getting back to that informed consent, if you actually understand what the things are, then you can actually make better decisions, better health decisions for yourself, better financial decisions for yourself. It's not just, health, but just a little bit more knowledge, I think, would go a long way with everybody. And that's the one thing I always try to stress.
Yeah, I think, being in the medical space, you see that gap more pronounced than anything. But even I don't have a medical background at all. And my dad went through a liver transplant. I remember my uncle, like, in the middle of the surgeon came out to kind of give an update during the surgery. And my uncle turned to me and goes, "So where is the liver and how big is it?" And I'm just like, it's a little late to ask at this point, And so we all kind of told him, like, "We'll show you on the phone in a minute. We need to find out what happened in the OR." So,
no, I mean, that's very
People
common.
don't even know where things are.
Yeah,
Sorry,
I mean, it's
ahead.
very common. That occurrence is very, very common. And I think that's just a little bit of knowledge that I'd like to see people have more of, just so they can understand. Because if you think about it, if he had to go through the liver transplant, and he's like, "I don't even know where my liver is." And it's like, okay, you don't even know where your scar is going to be. You don't know what the recovery is going to be, because they have to go through your stomach wall, or your abdominal wall, and all that stuff. And it just leaves more explanations down the road.
Yeah.
I mean, like, your rehab is going to be hard. It's going to be hard for you to breathe because we had to cut through your stomach muscles and all that stuff. And yeah, I mean, it would just make everybody's job a little easier and people's understanding a little bit more.
Yeah, and you'd probably take care of your body a little more too if you were like, "Oh, that pain's not normal, and maybe I should see somebody."
Well, I mean, being a cardiologist, you always hear, it's like, "Well, I've had this chest pain. It's been going on for 3 months, but it just is what it is." It's like, no, if you would have cut. I mean, the joke we always had, or not really joke, but it was actually a truth, was that the days we hated being on call were the days after the major holidays, because people would sit through and suffer through their heart attacks on, like, Christmas, New Year's, Thanksgiving, or something like that.
They didn't want to ruin the party.
They want to ruin the party. And, because they're like, "Oh God, I've ruined the party and I'll be there for a couple of days." But actually they'd go in the next day, and it's like, I would always tell the patients, it's like, "Look, if you would have come in and ruined the party, you'd be going home today and not being admitted and staying for 5 to 7 days." So it's that knowledge too. But in time, people will learn, and which is all that matters.
Until then, you can call Dr. Chris, and if
exactly,
your problems get pointed in the right direction. I really do appreciate the time and all the knowledge, and thank you on behalf of the general public for all the years of service you've given as a doctor.
No problem. I mean, it's been a joy to do it. I mean, I've had great times doing it. I have great memories. And I've heard a bunch of great jokes from patients along the way too. So it's been a benefit to me too personally. So it's been a pleasure.
Great. Dr. Chris, thank you so much.
Thank you.